So talk about like gardening, how now it seems like it's fashionable.
Yeah.
Whereas I'm sure for someone like you, again, as a weight management specialist, you have been aware of these things, and these are things that are not new.
Right, right. Well, there's starting to be a shift in medicine to fully appreciate, some of the return to gardening and counseling patients on whole foods and just regular physical activity. It doesn't necessarily have to be a full fledged, even gym sort of thing. Just how can we be even more, physically active? They call it lifestyle medicine. So there is a shift, to that. Providers are being educated. There are certification programs on it. Again, they're trying to incorporate it in medical and nursing schools now. So it's slow, but it is coming. Okay, you may even notice with your own providers, they're trying to have different types of conversations. They're trying, with their patient as opposed to just writing, prescriptions. There is a shift. People are becoming more informed. There's videos and all kinds of how-tos on how to do some of these things. People want to take more control of their health. And I think that's important. And that's where it starts, right? What can I do, in order to take care of myself before it gets to the point where, things are out of control.
And then what about, like, people may not see it like this, but like again, this morning you took your son to the doctor. You're almost like an advocate for him, so that if it's something that he doesn't understand or later on doesn't remember or something the doctor recommends or suggests to him, then it's almost like taking someone with you that is more comfortable. Like my oldest sister, she's kind of still out with me on this because I would go to the doctor with her, and then the last time she wanted me to go, it's like 8 hours away from me. She's in Rockford, Illinois, and I'm like, okay, I can't come there just to go to the doctor with you for a 10-minute appointment.
Right.
But talk about the importance of, if you're not comfortable, if you don't understand, you should always walk away from these appointments having some understanding and or someone that you can talk with. And if you feel like you are, walking away a lot, not understanding the importance of taking someone with you.
Taking someone with you, or even doing like a semi-video chat. So maybe if you couldn't drive 8 hours to be with your sister, maybe she, puts you on FaceTime or something while she's in the office with the doctor. So then that way you both can hear it, and obviously this is with the permission of the provider as well.
Right.
I think that would also be helpful. You're right. We use a lot of medical terminology that can go over, your head, and you got a lot of questions, and maybe you're not even realizing it until you're out of the office, but having somebody there to advocate for you, to ask those questions, to be of support, can really make a difference.